Hi, welcome to Healing Talks with Kingdom Docs.
Hi, I'm Dr. Hussein Musa.
I'm Dr. Adatone Musa.
I'm a board-certified pain doctor, addiction medicine specialist, and anesthesiologist.
I'm a board-certified epilepsy specialist and neurologist.
And we're both experts in healthcare and fitness. Why? Because we're living and we have to deal with the same things that you do. We have to deal with the amazing amounts of food that's in front of us, the choices we have to make, the consequences of eating poorly, or the joy that you feel when you eat something that you really, really like and you have round 2 and 3. So it's a balance that we're all learning, and it's a balance that changes, especially as you age.
Yes. And it's also really important to build healthy habits. And one way is really to have that mindset that you can do it, and that decision to be intentional about your health and do it consistently, to be consistent.
Yes, and we talked how these dietary strategies and this decision can affect your health overall. Now, in my field with chronic pain, a lot of people have back pain, and that can be secondary to being overweight. And a lot of people are overweight because they're using food as a coping mechanism, or they're just not eating appropriately. Or even most common is they're eating how they always have. They're just about 10 years older, and what used to work no longer works.
Yeah, for sure. And unfortunately, as we age, our metabolism slows down. So that's the rate or the amount of calories that we're able to burn. So we have to compensate as we age, and we don't need as much food.
Yes, and especially for the chronic pain population, it's not just the consequence of weight. Even all the other joints that you may experience pain in. For example, if you have back pain, that can lead to hip pain, knee pain, foot pain, and that can all be improved with some weight loss. But even just the dietary changes of having too much sugar, salt, processed foods, those can cause inflammation that can worsen your pain syndrome. And if we start treating these syndromes, our medications can have side effects, especially the steroids that we like to use. That can also lead to weight gain, or some of the nerve pain medications that can lead to weight gain. So it's not just we're saying you have to lose weight. We're saying that the importance of focusing on your nutrition is a therapeutic strategy to help manage your pain, and also as a form of preventative medicine.
Yes, absolutely. And we all know about the cardiovascular effects of poor diet and lack of exercise. You know, if you're eating foods that are high in saturated fats, or foods that are even high in carbohydrates and sugars, there are so many things down the road that it can affect in your body. And one is something called, it can cause atherosclerosis. And that's hardening of the blood vessels in your body. As a result of the hardening, it can cause plaque buildup all over your body as well, specifically in the heart and also the brain. So it can lead to heart attacks in your heart or strokes in the brain.
Yes, and any area of poor blood flow can lead to, unfortunately, peripheral neuropathy, or it can lead to nerve damage. And that sort of nerve damage can lead to development of chronic pain. So there are so many things that we can go on about with diet, exercise, and poor nutrition, and how that can affect your health. But the main thing we want to focus on is you being aware of the importance of your diet and your nutrition, and how it is a strategy to help you maintain a healthy lifestyle to prevent the development of complications later on that can require interventions by specialists. And with every intervention we do, there's side effects. So the best thing that we can do is equip you with knowledge how to focus on your nutrition and avoid a lot of these side effects.
Right. Let's be good stewards of our body. So in the next episode of Healing Talks with Kingdom Docs, we'll talk more about specific dietary strategies.
Thank you all. Please visit us at kingdomdocs.com.
Bye-bye.
Bye.